about to get my teeth whitened. Why don't you tell everybody at home about the pros and cons? Because there's a lot of myths. Some people think, one, that it hurts to get your teeth whitened. I would not be here if it hurt. So, Dr. Watkins, thank you for letting me and reassuring me that, one, it doesn't hurt. But why don't you tell us about the whole process and exactly what we're going to go through?
Well, basically what happens with whitening. Whitening, as some people believe, of course, does give us an aesthetic result. That is, of course, makes our smile brighter. And, of course, in America, that is important for what we see on television and all the advertisement. But one thing is an interesting fact, whitening that does not hurt, is one of the few medical procedures that men actually embrace more so than women. You know, men are typically the ones least likely to go to the doctor, to the dentist, whereas in the situation where whitening takes place, men actually are more inclined to get their teeth whitened. Why? Well, chances are you're going to get a better job. You're going to have a better opportunity if you have a nice smile. At least, of course, in America. So we give the individuals a chance to sort of improve their self-esteem, improve their image, and, of course, improve their health. Because what happens, of course, is that you can't really whiten teeth that are not healthy. So the first thing we have to do, we have to make the teeth are healthy, which means the patient comes in with the idea, wow, I want my teeth to look better. But what we get to do as clinicians is we get a chance to educate the patient on getting ideas of periodontal disease or gum disease, restorative aspects, and that sort of thing. And therefore, they have to have everything basically disease-free before we actually go to the point of actually whitening. So it's our way of motivating people to come in for a purpose that may not seem that significant in terms of whitening, but it gives us a chance to really improve their overall oral health.
And I'm about to get started here. Dr. Watkins is going to do the ZOOM Whitening on me. So everybody, I'm going to sit back, I'm going to strap in, and then when we come back, I'm going to leave with a brighter smile.
Okay, Lydia, you are actually in the position where you would be when you go through a Zoom bleaching. And you're doing very well. I hope you're okay. Mm-hmm. You look like you're just so relaxed, but then you're such a professional. Now, what I'm first doing, even before we had this session, you recall that I examined your teeth. And I've examined your teeth, and of course, you're cavity-free, and you have very good hygiene. That's very important. What I've done, as you can probably tell we did before we started, was I have retracted your soft tissues because we don't want your gums or tongue in the way. Remember, this is a whitening material, and it works fairly well. In fact, if it got on your clothes, you'd have a spot on your clothes. So we don't want it to get on any soft tissue. It should be only on the hard tissue, only on the tooth surfaces. For that reason, we have everything retracted out of the way safely. Bear in mind that people who have certain kinds of habits will have greater benefits than others. For example, coffee drinkers, tea drinkers, individuals that eat a lot of curry, or some of the other staining foods, grape juice even, will have a tendency to have some darkening of the teeth, and of course smokers. Those individuals will see the most dramatic change. Those individuals that don't drink a lot of coffee and that sort of thing, well, you know, they'll have some changes that are going to be a little less dramatic.
Well, everybody, I'm about to unveil my brand new white teeth. I haven't even seen them yet, but of course, Dr. Watkins has hooked me up, so I'm about to see what it's all about. So any last words? I'm going to let him wrap it up and tell me about the process.
Well, we're very happy with the results. I think that Lydia has gotten a good result. As I indicated before, whitening is something that can be a great booster to self-esteem, not that she needs it, but something that I think we'd like to present for our patients. I'm very pleased with the result, and now I'm going to present her with the mirror. Is that what you think?
Oh, my gosh.
You like that?
I see a huge... I do see them.
That's right.
It's
That's right.
very white. They are very white. It's fabulous. I love it.
Look at those teeth. This is part of the Extreme Makeover.